Oh, the loss of coordination in my legs, I'd trip over my feet, end up flat in the concrete. Dr. Bonati to me was God sent. Walk like that in a while. I don't remember how long. I didn't have to make a massive lifestyle change. I noticed today that I could sit and stand up without a cane. I would have to give it excellent and above my expectations.
Visit AskBonati.com. Brian proudly served in the U.S. military, and in the years since, he keeps himself busy by working various jobs in the construction industry.
I've done condo conversions. I used to buy houses and swap them, flip them. So I've done all aspects of construction. Eventually,
Brian could no longer ignore the pain resulting from his physically demanding careers.
Over the years, I was really starting to get a lot of back pain. So I went to chiropractors and everything else. Now, it wasn't until probably about 90 that I had my first back operation. The spine was closing in on the nerves, so he went in there and cleaned out 2 or 3 of the vertebrae.
Brian, after enduring a couple of back surgeries that didn't eliminate his pain, had doctors in his hometown tell him a spinal fusion was his only option.
He put 6 screws in there, 3 on each side, and he put bars in between, linking the 3 screws together to help support me. Well, over the years, that actually worked a way in. It was pinching off some nerves, and I was in steady pain constantly. And I had to walk with a cane because what they did is, in one of the operations, somehow they did something where I couldn't push down on my toes and my feet. So I just kept on, when I leaned forward, that was it. I was done. You had to pick me up off the floor. I've been with a cane for probably 8-10 years now. As I walked, as I moved, I'd get shooting pains down my legs, almost like lightning rods going down my legs and then through my back. It got towards the end that I had burning from my tailbone all the way around my waist and right into the crotch where I was numb. So it was a case that I had no life whatsoever.
Brian was still in pain after his fusion surgery, so his wife began desperately searching the internet for an answer. And that's when they discovered the Bonati Spine Institute.
I was shocked because when my wife called Bonati Institute, set up the appointment and everything else, Dr. Bonati himself called back and talked to me. I was like, I couldn't believe this. I mean, a doctor's taking his time out to call me. I was shocked. And he talked and he told me exactly what he was going to do and how he was going to relieve the pain and everything else. And then I went in for the consultation.
Brian had updated x-rays and MRIs at the state-of-the-art on-campus imaging center, where surgeons can review images with their patients just minutes after they're taken.
When I went there, he actually showed me the x-rays and the MRI, and he showed me where these nerves were being pinched and everything, and he showed me the hardware in my back and everything. And he actually showed me what he was going to do, and he told me that I was going to be awake during the whole operation, and I was able to watch it. And at that time, he invited my wife in. Having my wife in there as an advocate was like 100% more relaxing for me.
Patients are often surprised how quickly they are able to be up and walking after their exclusive Bonati Spine procedures, without the debilitating pain that brought them in.
The relief that I got is just unbelievable. When I was able to walk off that table and walk out and go for lunch, I went in there at 10 o'clock, got operated on. At 12 o'clock, I was walking out on my own.
Brian highly recommends the Bonati Spine Institute to anyone suffering with neck or back pain.
I've never seen a greater bunch of people that work for him. Professional, friendly. I had all the confidence in the world.
Now, Brian is back to working in his workshop and riding his motorcycle, all pain-free.
Now I go to the store 2 or 3 times a week. I wouldn't want to go to Home Depot or Lowe's or anything like that because the pain was so great I couldn't walk through the store. Now I'm back to going picking up materials. I'm working on my shop. I take my trike out now. I sold my Harley and I replaced the engine and the transmission and the linkage, and I'm almost getting it ready for me to paint.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Rumble, Apple's App Store, Google's Play Store, Roku, and Amazon's Fire TV. Welcome back to American Medicine Today. I'm alongside Dr. Bonati, and we're going to tackle the subject of research as far as lab-grown organs go. So why don't you delve into what this truly is about?
This is not a new idea. In the 16th century already, people were thinking to find organs, to transplant organs. A scientist surgeon in Italy, his name is or was Daniel Petrucci. He used embryos with the idea to create and go beyond the embryo, that they will create organs, and then they will extract those organs and replace to humans. The idea in the 70s become really an outrageous ethical attack.
I would imagine.
That create a law that allowed the researchers to only use embryos for 14 days. After 14 days, the embryo needs to be destroyed or needs to be placed in a uterus or need to be frozen. With that idea came, immediately the industry started to talk about, if we can frozen, well, how about if we do an intravitreal
fertilization?
Pregnancy,
yes.
fertilization. So the in vitro fertilization then become a situation that create immediately for 1978 the first tube baby. Her name was Lucia Brown, and thanks to the results of that, around 12 million people are in the world today,
right,
that they use the in vitro fertilization to be able to become a person. So this idea of create some type of organs then become modified with the time. Despite that the embryo is being blocked and you cannot investigate further the human development, what really creates a problem for the investigators, because they cannot create an organ because they are blocked with the idea that the embryo cannot be touched. And then they start to think over that we need to use different type of ideas. For example, they start to talk about if we create artificial tissue. And then, for example, we're talking about the three-dimensional bioprinting.
Yes.
And the three-dimensional bioprinting brought the concept that we can create cells. And those cells are being placed in a type of a platform, and those cells grow to a certain level. But the problem is the modification of those cells. That maybe you can modify skin, you can modify bone, you can modify certain elements of tissue, but you cannot recreate organs, because you can create a kidney that looks like a kidney but cannot function like a kidney. You can create a heart that looks like a heart but cannot function like a heart.
These other organs would need certain vascularizations that they haven't been able to do yet?
Recently, we start to realize that the one who creates really the organ is the placenta. So the cells, we throw the placenta for centuries away. And recently, we start to realize that the placenta is the bypass to create really the organs. So if you need to have an organ that needs vessels, you need the placenta.
Interesting.
If you need an organ that can think, you need the placenta.
Okay.
If you need an organ that is going to pump blood through the body, you need a placenta. Because the placenta will create the specific needs of the cells.
We're going to take a quick break. We'll be right back talking about grown organs on American Medicine Today.
2 neurosurgeons couldn't figure out anything that was wrong with me or what I would need surgery for. Dr. Bonati, without even seeing me, knew I was hurting, knew they could help me. First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Visit AskBonati.com. Welcome back to American Medicine Today. We're continuing our discussion on the research about lab-grown organs.
Because the placenta will create the specific needs of the cells. But the adult cells or stem cells are organized, so they can do only one thing. If you put liver cells on those stem cells, it's going to create a massive organ that looks exactly like a liver, but it's not going to function. The organoids are very important because the organoids are being used by the industry in pharmacy to create medications, how the medications react in that organ.
All right.
In heart, for example, how certain type of medications are going to create an arrhythmia or stop an arrhythmia and things like that. Those things can happen through the organoids, but you cannot do that one through the organs. Through the organs, you need to have lymphatic systems, vascular system, nervous system, and muscular system. If you don't have those, the organ doesn't work.
It's incredible technology. We'll touch more on this in a future episode of American Medicine Today. Make sure you download our app by searching keyword AMT and keyword Bonati. If you have any comments or questions, contact us at the numbers below. Or you can tweet at Dr. Bonati using the hashtag American Medicine Today or hashtag AMT. We would like to hear from you.